Every single week, and I mean every single week, a patient walks into my office carrying a shopping bag full of supplement bottles. They set them down on the exam table and say, "Dr. Carter, just tell me the truth. Which of these actually do anything for my knees?" I've been having this exact conversation for over 20 years. My name is Dr. Ethan Carter, and I've spent more than 2 decades in clinical practice focused on the health and well-being of older adults. I've seen every supplement trend come and go. Some had promise, most did not, and a few surprised me. Today, I want to sit down with you, like I would with any of my patients, and give you the straight truth about the 3 most popular joint supplements on the market: glucosamine, collagen, and turmeric. No supplement company is paying me to make this video. I have no affiliate links in the description. My only goal here is to give you the same honest information I give my patients in the exam room, so you can make smart decisions with your money and your health. So if you or someone you love is dealing with joint pain, and I know how much that can affect your daily life, please stay with me through this entire video before you buy another bottle of anything. I think you'll be glad you did. Before we talk about supplements, we need to talk about what's actually happening inside your joints. Because if you don't understand the problem, you can't evaluate the solution. Inside a healthy joint, you have cartilage, a smooth, rubbery tissue that covers the ends of your bones. Think of it like the cushion on the bottom of a good pair of shoes. It absorbs shock. It allows your bones to glide smoothly against each other. And surrounding that cartilage, you have synovial fluid, a natural lubricant that keeps everything moving comfortably. Now, here's what happens as we get older. That cartilage, your natural cushion, starts to wear down. It gets thinner. It develops rough spots. And your body's ability to repair it slows down significantly. At the same time, the synovial fluid can decrease in volume and quality. The result? Bone gets closer to bone. You get stiffness. You get swelling. You get pain. This process is what we call osteoarthritis, and it's the most common form of arthritis in the world. If you're over 60, there's a very good chance you're already experiencing some degree of it, particularly in the knees, hips, and hands. Now, and this is important, I need to distinguish this from other causes of joint pain. Rheumatoid arthritis is a completely different disease. That's your immune system attacking your own joints. And then there's pain from old injuries, bursitis, gout. Each one has a different mechanism. Why does this matter? Because a supplement that might offer a small benefit for osteoarthritis may do absolutely nothing for rheumatoid arthritis. The cause matters, and knowing your specific situation is the first step. So with that foundation in place, let's look at each supplement and what the research actually tells us. Glucosamine and chondroitin. These 2 have been around longer than any other joint supplement on the market. You'll find them in almost every pharmacy, often sold together in a single pill. So let's talk about what they are, what the science says, and who, if anyone, should be taking them. What are they? Glucosamine is a natural compound found in healthy cartilage, specifically in the fluid that surrounds your joints. Chondroitin is another component of cartilage that helps it retain water and stay elastic. Your body produces both of these naturally, but, as with many things, production declines as you age. The idea behind the supplements is straightforward. If your cartilage is breaking down and your body is making less of these building blocks, why not take them as a supplement and give your joints the raw materials they need to repair? It sounds logical, but medicine runs on evidence, not logic. So what does the evidence say? What does the research say? The biggest and most important study ever done on glucosamine and chondroitin was the GAIT trial, the Glucosamine Chondroitin Arthritis Intervention Trial. It was funded by the National Institutes of Health, It included over 1,500 patients with knee osteoarthritis, and it was published in the New England Journal of Medicine. The results were mixed. For the overall group, glucosamine and chondroitin, whether taken alone or together, did not show a statistically significant benefit over placebo. In other words, for most people, they were not meaningfully better than a sugar pill. However, and this is the part that keeps the conversation alive, in a smaller subgroup of patients who had moderate to severe knee pain, the combination of glucosamine and chondroitin did show a meaningful improvement. That subgroup finding was interesting, but it was also a secondary analysis, and many researchers caution against reading too much into subgroup results. Subsequent Cochrane reviews, which are considered the gold standard for analyzing medical evidence, have generally concluded that glucosamine provides little to no benefit for most people with osteoarthritis. Some analyses have shown a small reduction in pain, but the effect sizes are modest and often don't reach the threshold that patients would notice in daily life. Who might benefit? Based on what we know, if you have moderate knee osteoarthritis, not mild, not severe enough for surgery, and you've already tried other approaches, glucosamine and chondroitin may be worth a 3-month trial. That's roughly the minimum time needed to assess any potential effect. Risks and considerations. Generally well tolerated. The most common side effects are mild digestive issues. However, if you're taking warfarin or any blood-thinning medication, please talk to your doctor first. Glucosamine may enhance the effect of these drugs. Also, many glucosamine products are derived from shellfish, so if you have a shellfish allergy, look for a synthetic or vegetarian version. My bottom line on glucosamine and chondroitin. Reasonable to try, but manage your expectations. If you've been taking it for 6 months and haven't noticed any difference, it's probably not your answer, and that's okay. Don't feel guilty about stopping. Save that money and invest it in something we know works, which I'll get to later in this video. Collagen is the supplement everyone is talking about right now. Your social media feed is probably full of collagen powders, collagen creamers, collagen gummies. So let's cut through the noise. What is it? Collagen is the most abundant protein in your body. It's in your skin, your tendons, your ligaments, and, critically for our conversation, it makes up about 60% of the dry weight of your cartilage. It's literally the structural scaffolding that holds your joints together. Now, when it comes to supplements, you'll see 2 main types marketed for joint health. The first is hydrolyzed collagen, also called collagen peptides. This is collagen that's been broken down into small fragments that are easy to dissolve in water. The second is undenatured type 2 collagen, often labeled as UC2. This is a very different product. It's a small dose of intact collagen that's supposed to work through your immune system, essentially training your body to stop attacking its own cartilage. These are 2 different products with 2 different proposed mechanisms, so don't assume they're interchangeable. What does the research say? For UC2, undenatured type 2 collagen, there are a handful of clinical trials showing modest improvements in joint pain and function, particularly in people with knee osteoarthritis. Some studies have even suggested it may be more effective than the glucosamine chondroitin combination. However, and I have to be straightforward with you, most of these studies were small. Some were funded by supplement manufacturers, and the overall body of evidence is still limited. For hydrolyzed collagen, the powders and peptides, the evidence is even thinner when it comes to joint health specifically. There are some encouraging signals, but not enough high-quality, independent trials to draw firm conclusions. The big misconception. Here's something I tell every patient who asks about collagen. When you swallow collagen, whether it's a powder, a pill, or a bone broth, your digestive system breaks it down into individual amino acids, just like it does with any other protein. Your body does not take that collagen and deliver it directly to your knee joint like a FedEx package. It gets broken down, absorbed, and then your body decides where those amino acids go based on its own priorities. Does that mean it's useless? Not necessarily. Some researchers believe that collagen peptides in the bloodstream may signal your body to increase its own collagen production. But that mechanism is still being studied, and we don't have definitive proof yet. Risks and considerations. Collagen supplements are generally considered safe. Side effects are rare and usually mild. Occasional digestive discomfort, a lingering taste. The bigger concern isn't safety, it's quality. The supplement market is poorly regulated, and collagen products vary enormously in their source, purity, and dosage. What's on the label isn't always what's in the bottle. My bottom line on collagen: promising, but not yet proven. If you want to try it, I won't discourage you, but go in with realistic expectations. Choose a product from a reputable brand that uses third-party testing and give it at least 2 to 3 months before you evaluate. And please don't let collagen supplements replace the strategies that we know are effective. Now, turmeric. This is the one that honestly has the most interesting science behind it, but also the biggest practical challenge. What is it? Turmeric is a spice, the bright yellow powder you know from curry. But the active compound we care about for joint health is curcumin, which makes up only about 3 to 5% of turmeric by weight. Curcumin has potent anti-inflammatory properties. In the laboratory, it's been shown to inhibit several major inflammatory pathways in the body, including NF-kappa B and COX-2, the same pathway targeted by common anti-inflammatory drugs like ibuprofen. What does the research say? Of the 3 supplements we're discussing today, curcumin has the strongest body of evidence for osteoarthritis pain. Several well-designed meta-analyses, studies that pool results from multiple trials, have found that curcumin can reduce pain and improve function in people with knee osteoarthritis. Some studies have even shown it to be comparable to low-dose NSAIDs. That's your ibuprofen, your naproxen, for mild to moderate pain. That's noteworthy. That's a real signal. The biggest problem? Absorption. But here's the catch, and it's a big one. Curcumin, on its own, is very poorly absorbed by your body. If you just take plain curcumin powder, most of it passes straight through your digestive tract without ever reaching your bloodstream. This means that the formulation of the product matters enormously. You need a curcumin product that includes some form of absorption enhancer. The most common is piperine, which is a compound from black pepper. You'll see it listed as bioperine on many labels. Piperine can increase curcumin absorption by up to 2,000%. Other formulations use lipid-based delivery systems, like Meriva, which is a curcumin phospholipid complex, or nanoparticle formulations. The takeaway: not all turmeric supplements are created equal. If your product doesn't address the absorption problem, you're essentially flushing your money down the drain, literally. Risks and considerations. Curcumin is generally safe for most people at standard doses. However, there are some important interactions and cautions. Like glucosamine, curcumin can interact with blood-thinning medications, warfarin, aspirin, and others. It may also affect blood sugar levels, which matters if you're on medication for diabetes. High doses can cause digestive upset, nausea, diarrhea, stomach discomfort. And if you have gallstones or a bile duct obstruction, curcumin is generally not recommended as it can stimulate bile production. My bottom line on turmeric and curcumin. Of the 3 supplements we've covered, this one has the strongest evidence. But, and I cannot stress this enough, the quality of the product matters more here than with almost any other supplement. A cheap turmeric capsule from a discount bin is not the same thing as a well-formulated curcumin product with proven bioavailability. If you're going to try one joint supplement, this is probably the most reasonable choice. But choose wisely and talk to your doctor if you're on any medications. All right, I've given you my honest assessment of each supplement. Now I want to step back and share something that I think is even more important. In 20+ years of caring for older adults, here's what I've learned. The things that have the strongest evidence for protecting and improving your joints are not things that come in a bottle. Movement. This is number 1, and it's not even close. Regular, appropriate physical activity is the single most effective intervention for osteoarthritis. I'm not talking about running marathons or lifting heavy weights. I'm talking about low-impact movement. Walking, swimming, water aerobics, cycling, Tai Chi. These activities strengthen the muscles around your joints, improve flexibility, reduce stiffness, and can significantly reduce pain. I know what some of you are thinking, but Dr. Carter, it hurts to move. I hear that every day, and I understand. But the research is overwhelming. Appropriate exercise for osteoarthritis reduces pain more effectively than any supplement on the market. Start small, start gentle, but start. Weight management. This one is simple math, and it's powerful. For every single pound of body weight you lose, you reduce the load on your knee joints by approximately 4 pounds. So if you lose just 10 pounds, that's 40 pounds of pressure taken off your knees with every step you take. No supplement in the world can match that kind of mechanical relief. Physical therapy. A good physical therapist can design a targeted exercise program that strengthens the specific muscles supporting your affected joints. They can also help with balance, range of motion, and pain management techniques. Insurance often covers physical therapy for arthritis, and in my experience, patients who commit to a PT program consistently see the greatest improvements. Knowing when to see your doctor. Supplements and lifestyle changes have their place. But if your pain is worsening, if it's affecting your sleep, if you're avoiding activities you love, if you notice sudden swelling or warmth in a joint, please don't try to manage that with supplements alone. There are effective medical treatments available, and your doctor needs to be part of the conversation. Here's how I put it to my patients. Supplements can be one piece of the puzzle, but they should never be the whole puzzle. Before I let you go, I want to give you a simple checklist, something you can use the next time you're standing in the supplement aisle or browsing online. Before you buy any joint supplement, ask yourself these 5 questions. First, have I talked to my doctor? Especially if you're on any medications. Drug interactions are real, and your doctor needs to know what you're taking. Second, does this product have third-party testing? Look for seals from USP, NSF International, or Consumer Lab. These independent organizations verify that what's on the label is actually in the bottle. Third, am I giving it enough time? Most joint supplements need at least 8 to 12 weeks before you can fairly evaluate whether they're helping. Don't expect results in a week. Fourth, am I also doing the things I know work? Movement, weight management, physical therapy? If you're relying on a pill alone, you're leaving the most powerful tools on the table. And fifth, am I being honest with myself about the results? After 3 months, ask yourself, is my pain genuinely better? Can I do things I couldn't do before? If the answer is no, it's okay to stop. You haven't failed. That supplement just wasn't the right fit for your body. Now, let me give you the 30-second summary of today's video. Glucosamine and chondroitin, reasonable to try for moderate knee osteoarthritis, but the evidence is mixed. Don't expect dramatic results. Collagen, promising, especially UC2, but the science is still catching up to the marketing. Manage your expectations. Turmeric and curcumin, the strongest evidence of the three, but only if you choose a product that actually gets absorbed. Formulation matters. And above all, movement, weight management, and working with your healthcare team will always outperform any supplement. I want to finish with this. I know joint pain is more than just a physical inconvenience. It can keep you from playing with your grandchildren. It can stop you from taking walks with your spouse. It can make you feel like your body is betraying you. I hear these stories every day, and I want you to know I take them seriously. My goal with this video is not to sell you anything or scare you away from anything. It's to give you the same honest information I'd give my own family, so you can make informed decisions. If this video was helpful, I'd appreciate it if you'd hit that like button. It helps other people find this information. And if you haven't already, consider subscribing. I make videos like this regularly, focused on helping you age well and live fully. I'd also love to hear from you in the comments. Have you tried any of these supplements? What was your experience? Your stories help other viewers, and they help me understand what topics to cover next. Take care of your joints, take care of yourselves, and I'll see you in the next video.